hmm How do you see cost playing a role in things like information sharing and transfer, or even maybe insurance? I know there's a lot of red tape around people even having access to their medical information. Seems like it's a little different process between institutions. Um, when it comes to this type of kind of care communication, whether it's in the birthing process or another, as far as cost and insurance goes, how do any of those things, if at all, play into that process?
For information sharing
Yeah.
or okay, specific? Yeah, I mean, I think um, data is actually very expensive, but also very cheap. We value it very high, but the entire process of moving data points from one place to another actually does not cost very much at all. However, the places where you see the most costs usually has to do with the institution itself and the way that their data systems are actually set up. A lot of institutions have legacy data stacks or technology stacks, is what we kind of call it. So that's comprised of like your EMR as a core, but also is comprised of things that you use to register a patient. Your pharmacy might have a different software that they use. Your billers might have a different piece of software that they use. The list goes on and on and on and on. And you can imagine a hospital that's been around since, the 1950s. They've gone through multiple different iterations of what that software might look like. The issue is that people don't tend to remove an entire data stack and then replace it with a different technology stack. It's more of like a bits and pieces that are coming out and then getting redeveloped and getting inserted back in there. What that leads to is a very disjointed way of handling information that leads to a lot of different inefficiencies and a tremendous amount of cost. Data right now and software right now is relatively cheap compared to how it was, maybe 10, 15 years ago. 15 years ago, 20 years ago, we're all on servers that were embedded or installed at a hospital. And you'd have to hire like IT staff to maintain those servers. You'd have to have an entire team of individuals ready to do that. But nowadays, most services are on cloud provisions, and that makes it a lot cheaper and a lot easier to modify and actually make things a lot more smooth. So as we kind of move towards that paradigm, and we're kind of shifting from the hospital owning the infrastructure to software companies owning the infrastructure instead, I think we're going to see a lot more momentum towards that ideal situation where information is freely shared, it's freely given, freely accessed by the people who actually need to access it. And we're able to actually move forward on that premise.
What emerging technology implementations or research regarding OBGYN or just information sharing in general are you most excited about?
Well, I think one of the biggest things is the idea of robotics in gynecological surgery. Um, when I went through residency, I trained on a robot. Since then, there have been multiple different iterations of that same technology that makes it much simpler to perform surgery. The outcomes are much better, and the techniques that you can actually employ while doing surgery are incredible. So being able to take hold of things like that, um, I'm very excited about things like like robotics. But there are also different techniques that my colleagues in other specialties are actually developing. They're actually very helpful to women in my practice. So things like fibroid embolization, excuse me. Um, Classically, what we used to do as gynecologists, everybody gets a hysterectomy. You have bleeding issue, do not pass go straight to hysterectomy. I'm simplifying, obviously. It's not actually like that, but the emphasis was on that definitive management of that problem. But now there are so many things that we can do, so many different medications that we can try, and so many more minimally invasive techniques that we can employ to help our patients. It almost makes it so that hysterectomies are even further down the line of your your strategy for helping a patient through their issue. So being able to incorporate more techniques like that are things that we should definitely stay aware of and stay ahead of.
Wow. Well, this has been an amazing conversation. Thank you so much for joining us here on MD Newsline podcast.
Thank you.